Hey friends, Dr. Christy here. So I wanted to come on for a minute and just talk to you guys about hip pain and the most common causes that I find, at least some musculoskeletal things, and what some things you can do about it. So first off, the psoas muscle. The psoas muscle actually attaches to the front vertebral bodies of your spine. So the bones in your low back, that psoas muscle actually attaches to the front of those and then comes down and attaches into the side and to the interior thigh. That muscle often gets tight, and physical therapists will tell you to stretch it out. One way to stretch that out is to do kind of a lunge position like this and lean your pelvis forward so you can get that stretch. In addition to being tight, I often find this muscle weak. I'm going to wrap your head around that for a second. Just because something is tight doesn't mean that it also can't be weak. Frequently, we get tight muscles because the muscles and the nervous system is trying very hard in order to work that as tightly as it possibly can, but the firing pattern is not functioning because the wiring, so to speak, isn't intact. So neurologically, that muscle is shut off. When I say weak, I don't mean you need to go to the gym and work it out more. I mean, it's functionally neurologically inhibited. So stretching it might give you some palliative relief, but it won't actually correct the underlying problem. Underlying problem, let's ask what that psoas muscle is related to. In my world, that is a kidney-related muscle. So the number one thing I think of is hydration. Please make sure that you're really, really pushing the right amount of water for your body, because that's what's going to give you the appropriate balance for that kidney meridian and proper function of that muscle, at least from a nutritional aspect. Stretching it can help. Even doing some massage in that area, that's going to end up getting very deep. You literally can get in deep to the abdomen. This is not a very flattering angle, so forgive me, but deep inside the abdomen and then into the side of the thigh right there, that would be one of the best ways to access the psoas muscle. Another muscle I find implicated in hip discomfort is the gluteus medius, not the glute maximus. That's our giant butt. The gluteus medius is a smaller muscle that attaches into the side of the hip, right where the biggest part of the hip bar, and then up into the sacrum and a lot of the tissues in the back. When that muscle is weak, often that's related to some hormones. So I see a lot of women with hormonal imbalances that sometimes have that as a primary musculoskeletal manifestation of that in their body. You can work that with a tennis ball. So I often say, if this was a tennis ball, if my fist is a tennis ball, and you're going to see my railing here for a second, if we put that against a wall and we roll it back and forth right across that belt line and down into the side of the hip, that's one of the best ways to handle and work to get some of that strength back in that muscle, so that it will provide some not only palliative relief as far as how that pain is being manifested in your body, but also bring it some strength back so that the firing pattern can get back on. Those are two of the primary muscles I find weak and have issues with. Other ones, there's many others that can be implicated. Another one that I often find more so with knee pain, but it's also attached to the hip, is the sartorius muscle, which is adrenal related. And so anything that is stressful in your life, whether it be emotional stress, weather stress, nutritional stressors, sleep stress, physical stressors. Pain is a physical stress to the body, of course. So any stress can impact the adrenal glands, which then can impact the sartorius and gracilis muscles, which impact the hip and the medial side of the knee. So just a couple thoughts. It's not always just as simple as stretching that psoas or taking time off of your workouts. Think about this in a bigger picture. So those are the couple things that I wanted you to try today. If you have some hip discomfort, hydration, watch your stress levels, check your hormones from that perspective. And then also we can stretch the psoas muscle, but also massage it at its origin and insertion points, deeply in the abdomen, into the upper leg, as well as the gluteus medius muscle right in the low back, onto the side of the hip, and even the sartorius muscle, sometimes right underneath the top of the hip and the inside of the knee. Hope that helps you today. If you have any questions, get some one-on-one care with me or somebody else that you trust, because this is not a substitute for personalized one-on-one medical attention, of course. And if you like this content and you have any other questions, drop them here. Have a good day.